Hello and welcome to our COVID-19 update program here on Channels Television. I am Ladi Akere-Doluale. Here are the highlights for this hour. Succumbing to public pressure, House of Reps resolves to subject the Infectious Diseases Bill 2020 to public hearing, just as the Presidential Task Force meets with the lawmakers. Easing Lagos-Ogun border traffic, police move checkpoint. And UK testing falls below target for the third day. Commercial activities resumed on Monday in Nigeria's capital, Abuja, as well as in Lagos, its commercial capital, after the government announced the gradual easing of restrictions to curb the spread of the coronavirus pandemic. President Muhammadu Buhari had the previous Monday approved a phased and gradual easing of lockdown measures. With what has been seen in the first 2 days following the easing of those restrictions, it's pretty clear that these guidelines are not being adhered to. And this brings to mind the question of how effective the compliance measures put in place have been. That's going to be the focus of some of our discussions today. But before then, let's quickly take a look at some of today's stories. The Speaker of the House of Representatives, Honorable Femi Gbajabiamila, has succumbed to pressure and resolved to subject the Infectious Diseases Bill 2020 to public hearing following the outcry over the document being debated by the House of Representatives. The bill had already passed the first and second reading last Tuesday and was scheduled for the next stage today. Part of the concerns raised by some members of civil society include the speed, the wordings, the intendment of the drafters, as well as the timing of the bill. However, the Speaker disagrees with those who question the timing. He also denies that the leadership had received $10 million to pass the bill. He describes the allegations as weighty and promised that the House will be taking legal action against those peddling the story. Meanwhile, the Presidential Task Force on Response to COVID-19 says it is not aware of the total amount of money that has been donated by individuals and corporate bodies to the federal government's fight against the disease. The chairman of the PTF made the statement during an interaction with legislators in the House of Representatives today. The lawmakers also received an apology from the Director General of the Nigeria Center for Disease Control over his statement that this was not the best time to pass the Infectious Diseases Bill. Our correspondent Terry Ikumi reports.
It was an intense 3-hour interaction between the Presidential Task Force and members of the House of Representatives.
Can handle that or any other person. Yeah.
It is coming a week after the House considered a motion to investigate the death of hundreds of people in Kano State.
We have mobilized about 3,300 informants through the WHO polio program for house-to-house search and reporting of suspected cases.
We are not enrolled in any vaccine trial because the processes have not yet been developed enough for them to be safe enough. Once they're developed well enough, we may consider taking part.
The question and answer session begins with the Speaker querying the DG of the NCDC over his statement about not amending a law in the middle of a crisis or a pandemic.
How does the current law deal with somebody who escapes an isolation center today? He also purported to have said that no one consulted you.
Mr. Speaker, I am sorry if these comments caused any offense, but you could not have a stronger ally in the review of our legislative framework to the fight against infectious disease in our country. But I was answering to a specific question by the journalist at the time. Had I been consulted? The only honest answer to give at the time was that I hadn't been.
While some lawmakers are unhappy that the opening statement of the chairman does not address the cause of the deaths in Kano State, others are interested in the donations so far received by the federal government.
We wanted to know the reasons for the mysterious deaths. And yesterday in the press, it was put or ascribed to COVID-19.
The person who's heading the federal team in there did not ever say that the people who died from coronavirus disease.
That we lost 640 of our citizens. It is bad they are dead, but it is worse that we do not know what killed them.
The parliament want him to be specific in the amount of money contributed by Nigerians and non-Nigerians.
Whatever is paid into those accounts on a daily basis, it is mopped into the PTF account that is domiciled with the central bank. If I knew that was required, I would have asked the Accountant General, how much have you realized? Because I don't have access, neither does the PTF has access to that account. None of the accounts is under my direct control or that of the PTF.
The PTF chairman charges the lawmakers to enact laws to prepare the country for any future pandemic, and that will also transform the nation's healthcare system. Terry Ikumi, Channels Television News.
As part of efforts to effectively monitor the movement of persons across the boundary of Lagos and Ogun states, security operatives have relocated the frontier post in the Berger area to the foot of the Long Bridge. During the operation, the commissioners of police in charge of the two states explained that the relocation will allow for smoother operations. They asked that those who do not have any need to cross the border to stay back or risk being arrested.
This has been the daily experience of road users across the Lagos-Ogun boundary since the easing of lockdown on COVID-19. Heavy traffic, massive movement of commuters in and out of Lagos without observing physical distance and violation of traffic regulations, especially by commercial drivers. The Lagos-Ibadan Expressway boundary between Ogun and Lagos has also been experiencing gridlock since Monday, forcing the police commissioners of both states to swing into action, arriving at the scene.
What we have agreed to do is to make sure that the interstate lockdown is very effective in such a way that if you are coming from Lagos and you don't have exemption, and that is why we have gotten a wider corridor, you will now be turned back to Lagos. The same thing if you are coming from Ogun State to Lagos and you are not among the categories of persons that is allowed to move within this specific period, you will equally turn back to Ogun State. And that is why we decided to choose this a place that is a little bit wider. No matter how heavy, no matter how wide the vehicle, it should be able to navigate around these axis.
On the Lagos side, the police chief and his counterpart from the Road Safety Corps warn that only those on essential duties will be allowed access into the state.
It's still an appeal. We are still appealing to their conscience so that let them come to the terms that this virus is real. This virus does not discriminate between an elderly person, a younger person, so between a male and female, so between a rich and poor. So once we have this one behind our mind and nobody wants to fall sick, then we need to prevent it. And by preventing it, let's just follow the full steps, what the government have said. Constant washing of hands with soap, so maintaining social distance so that it doesn't spread, and equally sanitizing our hands. So anything can you just cover the nose because it's the nearness that spreads it. If somebody is here and 6 meters away, it can't be spread. But the nearness, when somebody sneezes, when somebody coughs now, you spread it. I want to curtail the spread so that the government and the economy of the country will come back to normal as it was before coronavirus.
I know that it's not going to be easy, like what you saw yesterday. It was like everybody just came out. And that is one misconception I want to correct. Please, this easing of lockdown is not that everybody should come out yet. No. The presidential directive on who and who should be out is still there. It's still in force. But we misunderstood it. Particularly in Lagos, they took it for granted that everybody should just go. There are companies that don't have business opening up. For example, I don't know what a car showroom is opening up for now. It's not among the essential services, and that accounted for that upsurge in traffic we witnessed yesterday. I understand that people have been caged for 5 weeks. Yes, there's this eagerness to just go out and do one thing or the other. But I want to appeal that that misconception should be corrected.
For now, the Joint Security Frontier Post is situated around the U-turn point before the Long Bridge, easing the traffic outbound Lagos, a decision they believe will quell the tension being created by the gridlock.
Now, one of the states that is also witnessing compliance under the lockdown or the easing of the lockdown is Ekiti State. And the number of cases, of course, of COVID-19 has gone up in that state since the lockdown began. We're being joined now by the Commissioner of Police in Ekiti State, CP Amba Asukwo, via Skype from Ado Ekiti. Good evening, Mr. Asukwo. Thank you for your time.
Good evening. Thank you.
What is the situation in Ekiti like at this point in terms of monitoring of the compliance, and how easy has it been to keep people to the guidelines as stipulated by both the Presidential Task Force, the federal government, as well as the state government?
Well, for Ekiti, I think it's really relatively been going on very well. We don't really have challenges in keeping people on, but we have challenges in manning our border that is about 300 kilometers, and you are aware we have about 14 points of entry. So it's this point of entry that is really a challenge, because some of them are within the bush parts, but there is a strong synergy within the security agencies and other stakeholders to see how we can man these borders, because the cases we had experienced are those that come into Ekiti and not really those that reside in Ekiti. There's so much consciousness within the citizens, and the sensitization program of the government is going on very well. So everybody is conscious of the pandemic, and we are doing everything possible to encourage people to know the seriousness of the issue at hand. And besides that, the state government had even created a window where people could go out and purchase their needs before coming in to have. So we are getting used to it.
In terms of compliance with the regulations, things like social distancing, the wearing of face masks, you just mentioned now that we have. I don't know if we still have the Commissioner of Police with us. Indeed, I seem to think that he is there, although there have been one or two issues. Now, Commissioner of Police, can I ask you, things like social distancing,
Hello?
and we're with you if you can hear us, things like social distancing and the wearing of face masks, how easy has it been to enforce compliance with that in Ekiti?
For now, since it came into force, we've been trying to educate people and make people understand that it is something we have to live for now. And the compliance is not too difficult, but we try as much as possible to make them understand that there is need for it. And we've seen that some people are already on it. It's only that we've closed the major markets, so we don't allow that to really be a barrier. But somehow, I think every day would get better and everybody would keep on understanding, because we see improvement. We just hope that the banking industry would provide more outlet for people to make use of, so that we can enforce the social distancing aspect.
Thank you very much, Honorable Commissioner of Police in Ekiti, Mr. Amba Asukwo. It's been our pleasure having you with us. It's day 2 of the ease in lockdown measures, and Nigerians appear to be stepping up their game in compliance across the formal and informal sectors. Where there have been few skirmishes, especially in the area of access to fiscal banking services, safety measures in the public and open markets have been heightened. Our correspondent, Temple Ashaju, reports.
Business activity is back in Lagos, but it is skeletal, and this follows the directives of government as part of plans to ease the lockdown in phases. The first phase of easing shows some level of compliance among financial institutions and corporate organizations and even regulators. But it's a different kettle of fish for banks and their depositors.
Since morning, around 7 o'clock, I've been here. I will not be able to collect money till tomorrow. They now give me another number to come tomorrow morning.
We are catered for the poor in the church. You know, we are only giving some people money every month. That's the money that I come and collect. And since yesterday, I couldn't see the money to collect it.
As with the corporate organizations, the informal sector also has between 9 a.m. and 3 p.m. to open daily. And just as the corporate organizations have decided to alternate the opening of their branches, so it is with the informal sector.
There are people that open, like cosmetics attachment today, they didn't open. Today is food and beverages that open. And you can see now, people are landing up already. That means they are complying.
We were here yesterday. Today we are off. So tomorrow we'll be here by the grace of Almighty God. But next tomorrow we'll be off as well.
This reopening comes after 34 days of total lockdown in Lagos and Abuja, as the Purchasing Managers Index for April slips from 47.9 in February to 45.8 reading, showing the direction of economic trends in the manufacturing sector. An alternate opening of businesses and shops is a trend that is expected to continue until the curve of COVID-19 is flattened. And until then, one thing that will remain central to the private sector activities is safety measures. Temple Ashaju, Channels Television News.
All right, thank you very much, Temple. We can now go to that new frontier post between Lagos and Ogun States, where our correspondent Olu Phillips joins us. Good evening, Olu.
Good evening, Ladi. Good to hear from you again tonight. As always, yeah.
What is the situation there? Yesterday, there was a huge tailback of traffic at the previous point where vehicles were being checked into Lagos, inbound Lagos yesterday. They've moved it now further down to the foot of the Long Bridge. What is the situation there at this point?
Okay, so Ladi, let's be clear again tonight about what. Ask me about effective and timely reporting. I will tell you what we did yesterday here on Channels Television. We took our crew right there live to where the quagmire is, and that's at that point in Berger where they are stopping people without having any provisions for them to either make a U-turn, but rather have them stay there permanently because of the 8 p.m. curfew. Now, after reporting effectively, we can tell you that the AIG, the DIG, the two commissioners of police for Lagos and Ogun State had an emergency meeting to decide on how best to solve that traffic quagmire. So they've moved that situation or the checkpoint to this point just behind me there. Now, so if you're coming out of Lagos, inbound Ogun State, you have to be checked somewhere in front of me here. And that's if you do not meet the 8 p.m., if you beat the traffic before 8 p.m. And if you're coming from Ogun State, at that foot, at the end of the Long Bridge, which is where you're looking at some 200 meters away from here, is where you will be stopped. Now, the unique thing here is that if you're on this stretch, you need to understand something very unique, and that's that there is a presidential directive that has locked down or that has made interstate movement impossible by way of a lockdown. But that directive, to my mind and to any discerning mind, did not effectively take into consideration the fact that cities like this or states like this interwoven and interlive. So you have people who live in Ogun State and work in Lagos State, but remember that Ogun State, as we speak right now, is on a lockdown. Now, so if you live in Ogun State and you need to work in Lagos State, how do you get on the road? That's one. Two, there's an 8 p.m. curfew. A lot of people are still not sure or are confused about how this works. Otherwise, you won't be seeing people, commuters, transporters, private car owners getting onto the road after 8 p.m., thereby making it difficult for those who should actually make their way in and out.
All right, Olu, thank you very much for your reporting there. We'll keep an eye on the new frontier post and see how effective that is in the days ahead in terms of the compliance. We'll take a break on our COVID-19 update. When we come back, we'll have the view from other places and talk about this enforcement and compliance a little further. Please stay on with us. Thanks for staying tuned, and welcome back to our COVID-19 update. The use of face masks is part of the compliance efforts of the guidelines that have to do with preventing the spread of COVID-19 nationwide. This has been a boon to those who make face masks and indeed new entrants into that particular sector of the economy. Our correspondent, Kayla McGuire, takes a look at this new enterprise in the nation's capital.
On the 6th of April 2020, the World Health Organization released a 5-page document titled Advice on the Use of Masks in the Context of COVID-19. In this document, the World Health Organization states there is currently no evidence that wearing a mask, whether medical or other types, by healthy persons in the wider community setting, including universal community masking, can prevent them from infection with respiratory viruses, including COVID-19. Despite this, Nigerians have been ordered to always wear face masks in public as part of the personal responsibility rules, and many people are complying.
For our life to be protected, we have to use it. It's not easy, but we manage it till this thing comes to an end.
Taxi drivers have also been instructed to ensure they and their passengers keep their masks on. As many businesses fear folding up due to the pandemic, the face mask business is cashing out.
No, I have a tailor that sews it.
Is anyone that used to check the quality?
No, nobody.
So you're just putting any cloth together?
No, as in we treat it, we iron it before we package it inside the leather. We press it with iron.
No actual standards are in place for how face masks should be made to ensure maximum efficiency. Should manufacturers of face masks get them tested and certified by NAFDAC so the public can know that they're buying a safe, effective product, even if it's non-medical grade?
The barrier face mask should be thick enough so that if a lighter is in front and you blow it, if it doesn't blow off that light, it means that it is protective enough. Meaning that if I'm talking, it will not get to you. And whatever you are doing, yours will not get to me.
So, the non-medical face masks in circulation may not be foolproof against COVID-19. But does that mean we should stop wearing them? For many, as long as there's a consciousness that these disease droplets can be passed from one person to the other, any barrier to that spread is welcome. Kayla Magwa, Channels Television News.
Kayla joins us now from our Abuja studios. Good evening, Kayla, and a revelation there about the masks. First of all, the WHO doesn't say they're essential. And secondly, nobody's checking the ones that many Nigerians are buying. So it brings us to our topic today, the issue of compliance, guidelines, and all of that. Wear face masks, but it doesn't say exactly what type and how to go about making it for those who are making it.
Good evening, Laddie. I think when it comes to the issue of face masks, maybe we're looking at it from a localized perspective. And like I said at the end of that report, the idea that there can be a barrier stopping the droplets from spreading from one person to the other, that's probably where, the mindset comes from, where everybody should just wear it, just wear the face mask, But of course, you saw the document there from the World Health Organization. The NAFDAC Director General, the Prof, was very explicit. She actually said that you should do a test whenever you buy a face mask. Try to put a lighter in front of it, and if you can blow the lighter off, then maybe you shouldn't buy it. And then, of course, she was talking about for manufacturers, the weight of the face mask is actually very important if it's going to be more effective. So these are some of the things I think, Laddie, that these are some things that will unfold, maybe more regulations on this. This is novel. Remember, we've not had to deal with this before. So a lot of these things are probably new to many of the agencies that are supposed to, man them, but we'll see what happens. Maybe we'll see more regulations as the days unfold. And to your question about enforcement. That's also another issue. I was looking at the Quarantine Act, the one that was in the 1920s, and it was very interesting, to see what the penalties were and, what the regulations were at the time. Now, for the times that we're in, I'm seeing a lot of law enforcement trying to appeal, like I said yesterday, to the conscience of Nigerians and not be as strict as people would expect them to be. When it comes to, overloading of cars, like I said yesterday, we saw the Federal Safety Corps stopping people on the road, and if you're not observing social distancing in the taxis, if there's overloading going on, they'll tell them to come down from the vehicle and then they take the car away. We also saw that during the lockdown. There were different penalties for different punishments, for different offenses. So if somebody was not performing an essential service and was outside, or if churches were on, or if a mosque is on, at the time when they say no more gatherings, we saw them face mobile courts. They were giving community service. They were giving, fines to pay and whatnot. So we're seeing a lot of these things. I do have to point out, Ladi, that this is new. And, we might be expecting a lot from our security agencies, and we should. We are taxpayers. We should expect a lot from the government. But these are things that I think they're learning and will adapt to as the time, goes on, Ladi.
In terms of compliance, and now having heard from you so many times about this, I'm almost scared to ask, has it improved in terms of the general situation? I mean, from yesterday to today, has the situation improved? I mean, it's new, as you said. Is it getting better?
Today, I saw that it was better, but today we spent most of our time, our roving was around the city center, So I saw that in Wuse. Okay, so many people had taxis, and this actually sparked a conversation. So people had their taxis lined up, and, there were no customers, and I said, you see, when everyone wanted to run outside yesterday and we're thinking everything was going to go back to normal. Not really, not really. I think as the days have unfolded, we're seeing that more people are taking their time to really assess the situation before they decide whether they're going to go out or not. One of the challenges with what we're going to face at this time is the fact that many people who are not performing essential services will be outside, and that would affect the plans to flatten the curve of this disease. But today in the city center, in Garki, in Wuse, I noticed that there wasn't a lot of movement, which was very interesting to watch. And another thing I saw today was that many people had their face masks on. In fact, most of the people that we saw in that report were actually working at the NMPC office, I think, in Central area. And if you notice, many of their face masks were the same, which means that they told me that the office provided it for them. They were talking about all the social distancing they have to do in the workplace, and all the education that has gone into it. So as much as many essential services have resumed work, many offices are stepping up their game. Banks today, I still saw some crowds in front of banks. The social distancing was poor, and of course, the services that the customers want to get, they were not getting those services. In the markets, for instance, today we saw that there's actually a rotation. I didn't know that this was a thing. I think it was when Temple was talking about it that I saw that, okay, so this is probably what was going on in the nation's capital as well, where the businesses are rotating. So it's not everybody that comes out at the same time. So we're seeing a lot of things change, Ladi, and I'm hopeful. I'm hopeful that things will be better by the end of the week.
Well, we are into the not post, but we are into the COVID era, and it will take a lot of adjusting. Thank you so much, Kayla, for your reporting, and do stay safe out there. Our correspondent, Kayla Maguire, reporting from our Abuja studios. Before we go any further, let's take a look at the COVID-19 figures in the country. As it stands, the total confirmed cases as at this time is 2,802. Of this figure, 2,291 are active cases because 417 COVID patients have been discharged across the country. But sadly, 93 people have now died from this disease. A look at the cases region by region shows that Lagos still has the highest in the country and in the southwest with 1,183 cases. Kano in the northwest has 365 cases. In the north central, the Federal Capital Territory has the highest with 297 cases. Borno has taken over from Gombe in the northeast with 100 confirmed cases. Edo State in the south-south had 62, and there are 8 cases for Enugu State in the country's southeastern region. The website of the Nigeria Center for Disease Control, the NCDC, has more information, including guidelines for employers and businesses in Nigeria on COVID-19 prevention in the workplace. We go to Owerri, the Imo State capital, where the government has relaxed the curfew in the state to allow for movement of residents. Let's hear more from our correspondent, Eitope Kutei.
It's a breath of fresh air for indigents of Imo State following the directives of the state government to relax some of its lockdown orders, especially on the opening of food markets and departmental stores. Even though the government gave specific guidelines on this policy, but to some Imo indigents, from what we witnessed today, it's as if the state government has lifted the total lockdown orders as they defy the lockdown orders and the social distancing order to carry out their normal business activities. Even sectors not listed under this order were open for business. And the streets of Owerri that has been empty for weeks came alive. However, we noticed the near compliance to the mandatory use of face mask in public.
It's a welcome development because people have been suffering. Because when you look at our society, it's a society whereby almost 95% of the people live on daily income. So total lockdown will affect people adversely.
Yes, the relaxation will at least ease their mind and they can begin to fend for themselves instead of sitting down and waiting for palliatives that may never come.
As of today, according to the NCDC, Imo State only has 2 cases of the coronavirus disease. Hopefully, the state government will increase its awareness and sensitization on its guidelines and regulations as they gradually relax the lockdown orders in the state to contain the spread of the coronavirus disease. From Owerri, the Imo State capital, Eitope Kutei, Channels Television News.
Let's go beyond our shores. Joining us via Skype from Cambridgeshire in the United Kingdom is a consultant renal and acute medicine specialist at the Northwest Anglia NHS Foundation Trust, Dr. Chris Agbo. Good evening, Dr. Agbo. Thank you so much for being with us at this time.
Good evening. Nice to have you again.
First, what is the situation in the UK now? We sometimes hear it would appear as if the UK is moving at a much faster speed than Nigeria is and most of Africa is. You're already doing contact tracing, apps, and other such stuff. What's the situation there at this time?
Well, the situation at the moment is that we've passed the peak period, which just about last week, and things seem to be declining now in terms of the number of deaths and also the number of hospital admissions. At the moment, we've increased the capacity for testing, which the government has actually increased the number of people that get tested on a daily basis. So we're having quite a large number of people being tested. And the plan for contact tracing is also there. Currently, the lockdown is still in place, and that's going to be reviewed towards the end of the week. And hopefully, there might be an extension to the lockdown because we've not really reached our targets in terms of getting to a reasonable low level to ease off the lockdown.
That brings me to my next question, which would be that if in the United Kingdom, in spite of all that has happened, in spite of all the statistics about the number of people who have been confirmed infected and those who have in fact died, the last time it was checked, it was over 26,000 who had lost their lives to this. There has been no ease of the lockdown.
No,
would you have wanted government to ease it?
Well, being at the front line, I think we just getting around the peak. We had about 29,000 or above deaths already, which this is the 7th week of the lockdown. And we're just beginning to see the decline in the death rate and also the decline in hospital admission. So this is not the right time to ease off the lockdown because we're going to experience a second wave. So we're hoping that in the next few weeks, things will settle down. And if the lockdown has to be done, it has to be done at a very systematic way so that we don't encounter a second surge of the pandemic. So I think the lockdown for now is satisfactory. It's giving us that room to actually see how we can control the situation. And hopefully in the next week or two, we'll be able to reassess the situation. And there might be a relaxation of the lockdown, but not completely. Things are not going to remain normal for a little while. So we're hoping that those are the measures that will help get the situation under control very, very well.
You might have guessed that my very next question will be, what do you make of the Nigerian government's decision to ease the lockdown here, given what you have given as the preamble to why the UK has not eased its own lockdown as at this time? What do you make of our own decision to ease the lockdown in the epicenters of the pandemic here?
Well, what I always say is that the strategy for managing or controlling pandemic in different nations actually vary. We're not looking at one size fits all kind of model. So the strategy that is used in the UK, why it's actually worked very well is that the fact that the public are fully aware of what is going on, and the government also made provision for people to stay at home. So if people are staying at home, not working, they need to make provision of how they're going to sustain themselves. So there are a lot of practical logistics that have been put in place, and that is helping the individuals, the public, to stay at home. So if we don't have a very well planned out strategy to make sure that people stay at home, it's not going to be effective. And if it's not effective, the lockdown is likely not going to achieve much results. So looking at the situation in Nigeria, it's quite a difficult or a different situation from the UK. We look at situation where a large proportion of people are on other private services, not public services. So if those ones are losing their income by staying at home, the government should look at how do we support the public. And also, there are other things that the public, the individuals, the governments, local governments, state government, and federal can also do to support individuals at home. But I think that having a lockdown will go a long way to contain the spread of the virus, because if you release it too early, it's going to, the effect that it had previously will just get overwhelmed. So I think that has to be reviewed, because in terms of lockdown, we need to put adequate logistics, especially from the government point of view, how people are going to be sustained so that they'll be able to stay at home. But if you don't have that in place, it's not likely that people are going to comply very well with what they are being told.
There is the question about the various remedies that are now being used to treat patients who have this COVID-19. This, depending on where you are, is subject to abuse, because plenty of people who get this information, whether or not they have COVID-19, go ahead and use some of these medications. But do you have hope? Are you optimistic that a vaccine or another kind of effective medication will be found anytime soon, so that the numbers of those who are being treated can be adequately attended to?
Well, at the moment, there are quite a number of trials that's going on. Like in the UK, we've entered into the 4th week of clinical drug treatment trial for all patients coming in with COVID-19 virus. And we're hoping to start getting the results of those trials. It's a very huge trial testing different kind of treatment options, which is about 4 or 5 treatment options. So we're hoping that we'll start getting the impact of those on the patient that are being tried on. And also there's a lot of work on research on vaccines, which that's probably going to take a longer time to come into play. But the most important thing is that the management of the patient coming in with COVID-19 virus is quite varied. And most often than not, we try as much as possible to get those ones that are severe not to go to the extent of getting to intensive care units. We've had quite a reasonable outcome in terms of people that are coming into hospital being treated with other complications related to the COVID-19 virus infection. However, the current treatment trial, which we're hoping that in the next week or two, we should be able to get results of how much it has impacted on the outcome in terms of patients that improve with different kind of treatment. So we're hoping to get that in the next week or two.
Thank you very much, Dr. Chris Agbo. It's been our pleasure to have you with us at this time. Dr. Agbo is a consultant, renal and acute medicine at the Northeast Anglia NHS Foundation Trust in Cambridgeshire in the United Kingdom. Thank you once again for your time.
Thank you very much for having me here.
We'll take a break, and when we come back, we'll find out the latest on what's happening with the COVID-19 pandemic in some other countries. Thanks for staying tuned. For the third day in a row, the United Kingdom government has failed to hit its target of 100,000 tests per day. Health Secretary Matt Hancock set the target at the beginning of April, and the government announced on Friday and Saturday that it had hit the 100,000 plus mark. But on the 3 subsequent days, the government has announced a figure well short of 100,000. The latest figures for the past 24 hours show 84,806 tests were conducted. These figures include thousands of tests sent out by post and which may not all be returned. Meanwhile, the UK now has the highest death toll in Europe, surpassing Italy.
The figures are rising as countries continue to mark a spike in their own figures. In the United States, a report from the Trump administration suggests daily death toll from the disease could reach 3,000 by June. The projection is based on government's modeling of the Federal Emergency Management Agency. The data also forecasts about 200,000 new cases each day by the end of the month, up from around 25,000 cases daily. It, however, remains the country with the highest number of cases of coronavirus and the highest death toll. India has seen its sharpest rise in daily cases yet, today with 3,900 fresh infections in the last 24 hours. The country now has over 46,400 cases of COVID-19, including more than 12,000 patients who have recovered or been discharged, and the 1,568 who have died. Now we're learning France's first known COVID-19 case was on December 27th, a patient who was diagnosed with pneumonia near Paris. His doctor told the media a swab taken at the time was recently tested and came back positive for COVID-19. The patient has since fully recovered, but says he has no idea where he caught the virus, as he had not been to any infected areas. Britain has overtaken Italy to report the highest official death toll from the coronavirus in Europe, with more than 32,000 deaths. Weekly figures from the country's National Statistics Office shows more than 7,000 deaths in England and Wales, raising the total for the United Kingdom to 32,313 as of this afternoon.
Grim figures there. Let's go to London in the United Kingdom, where our correspondent Juliana Olayinka joins us now via Skype. Good evening, Juliana. I trust you're keeping safe.
Good evening. Yes, keeping very safe, Mr. Laddie. Thank you.
Grim figures there, more than 32,300 deaths. Now, the UK having the highest death toll in Europe. But on the brighter side, there are a number of good things going on. This contact tracing app, which is being tested in the Isle of Wight. Why the Isle of Wight, do you think?
Well, I think the Isle of Wight is because it's an isolated island. Lots of people there know each other, families are related, and I think the government have seen this as a key place to try and test this app, because they do believe that once they ask people to download it, they will do so. And also at the moment, they've managed to pretty successfully contain the coronavirus spread. There haven't been many deaths. I believe they only have one main hospital, so it will be much easier to get people the help they need and the advice that they need. But really, I think it's just because it's convenient, it's off the mainland, and they can really focus on the results.
How about this vaccine trial that is also going on simultaneously with that? That, in fact, started before the contact tracing app was introduced. How is that going on, do you think?
Well, it's going pretty well, and of course we know that the race to find a vaccine is a global race. It's not just a race that involves Britain. Yesterday, the EU Commission President Ursula von der Leyen actually hosted a summit with about 40 other countries, and I believe about $8.3 billion was pledged towards finding a vaccine that wouldn't be isolated within your own borders, but a global effort. Prime Minister Boris Johnson was also on that call. hospital. And I believe that Britain pledged to put about £363 million into that pot. Now, before today, the conversation, of course, had been around Oxford and Imperial College London. The government had given them £44.3 million to advance their testing. I believe at the moment there are about 6 or 7 vaccines around the world that have gone into human study, and Britain are, of course, part of that twice. But we did have a daily coronavirus briefing today. It was hosted by Dominic Raab, the Foreign Secretary. And now the big story here in the UK is that he announced that they do believe there have been some sort of cyber attacks on a lot of the medical facilities and the hospitals, not just in the UK, but in the US, where these attackers are trying to hack into the system to find out exactly what scientists are working on. He didn't mention no names, although a lot of people close to the source are suggesting that China, Iran and Russia are the main culprits. So that's a huge story, actually, Mr. Laddie. That's growing here in the UK because, of course, we know whoever does find the vaccine is going to have massive diplomatic power. And, of course, most importantly, in pharmaceuticals, earn a lot of money at a time when all economies around the world are tanking. And so that's a really serious issue. And I think over the next couple of days, that's probably going to climb up the news agenda.
Thank you very much, Juliana. Please keep an eye on that story. As you did point out, it will be climbing up the news agenda, especially at this point in time. Thank you so much for your time, and do continue to stay safe out there. Our correspondent, Juliana Olayinka, reporting via Skype from London. And that's where we're going to wrap up today's edition of the COVID-19 update. Thank you for joining us. My name is Ladi Akere Duluale. Good night.